Everything looks fine. The doctor's assessment followed me for the next 6 months. But how could everything be fine? Every morning, I woke up more exhausted, more foggy, more unlike myself. My hair was thinning, my weight was climbing. I had 2 full periods a month and became anemic. At yet another appointment, after listing my symptoms again, the doctor smiled and said, "Well, nothing here explains how you're feeling. You can go home." They said this like it was a success story, like good news. The doctor seemed relieved, almost excited to be sending me home. No abnormal labs, no diagnosis to chase. Case closed. When they left me in that exam room, that was the moment I realized the system had made a choice. I was sick, but not sick enough. Here's the unfortunate truth. Our healthcare system isn't broken. It's actually performing exactly how it was designed, which is to respond when there's a crisis. We diagnose by chance and not by design. And it's not because doctors don't care or because we don't lack data or technology, but it's because the system is built to reward speed, volume, and procedures, not time, synthesis, and early problem solving. I've experienced this as a patient and as a daughter, a friend, and a partner to those who have gone untreated. I've studied it as a consultant, as I advised governments and health organizations on preventative care strategies. And I've worked in it as I negotiated with payers on what they would and would not pay for. From every angle, the pattern is the same. We are excellent at crisis care, but we fall apart when it comes to early diagnosis and coordinated attention. Tonight, I want to reframe healthcare as keeping people healthy, not just treating them when they're very sick. The shift from crisis to care is both an economic and a moral imperative. Let's zoom out for a moment. The healthcare system is made up of 4 key players: patients, providers, insurers, employers, and government. Individually, these actors are trying to do the right thing, but collectively, things start to break down. Imagine a fire department that only gets paid when a house is fully engulfed in flames. Not for setting up fire alarms, not for fireproofing homes, not even for putting out the little fires. Only for 5-alarm infernos. Now ask yourself, what kind of system does that create? That's US healthcare. Does anyone here have a favorite medical drama? Mine's Grey's Anatomy, and if you've never seen one, let me paint a picture for you. The camera pans down a chaotic hallway. Monitors are beeping, someone's being wheeled into the ER at full speed. A doctor rips off their gloves and says, "We're losing them." Another one screams, "Clear!" There's tension building, shouts in the background, a last-minute decision, a brilliant save, and cue the music. Now, no one's tuning in to hear the doctor say, "Good news, we caught this early, adjusted your lifestyle, and now you can go home." Preventative care would be terrible television, but definitely a better quality of life. So why is it that the US spends the most out of any other country in the world on healthcare, $4 trillion a year, but ranks among the lowest in terms of quality? Let me tell you what I've learned about incentives. Treating community-acquired pneumonia, catching it early, actually loses hospitals money. But waiting until that same patient deteriorates so badly that they need to be on a ventilator that's profitable. So early care equals loss, while late crisis care equals margin. And this isn't theoretical. In a fee-for-service model, you are paid for what you do. We pay for volume of intervention, tests, procedures, admissions, but not for a doctor to sit with a patient long enough to solve a complex diagnostic puzzle. So when you hear the system say, everything looks fine, what it's really saying is, you just haven't crossed the threshold where intervention is financially justified. Now, that's not medicine. That's math. Let's layer on insurers. Even when prevention works, when it saves money, insurers often don't benefit. Why? The average American stays with their health plan for 2 to 3 years. If an insurer invests in preventing cancer, diabetes, or any other chronic condition that develops over decades, another insurance company often reaps those benefits. So prevention is a cost to them, not an investment. And not just a financial cost to the system, but at a population level, it's millions of people living with preventable or manageable conditions until they become expensive, irreversible, and impossible to treat. There are models that are taking a more integrated approach. One example is Oak Street Health. Oak Street focuses on seniors, a population with high medical needs, but they flip the traditional model. Instead of rushing through 15-minute visits and fragmented referrals, they invest in longer appointment times, coordinated care teams, and social support. And critically, they are paid on outcomes, not volume. When hospitalizations drop, they benefit. When chronic conditions are managed early, they benefit. The result? A 20% lower total cost of care for their patient population. This kind of success only happens when prevention is core to the business model. So what can you do in a system that isn't designed around you? If you influence policy or capital, push for proactive models, single payer systems or portable insurance that extends the time horizon, payment models that are truly outcome-based and not fee-for-service, and integrated models like a Kaiser that keep patients for 8 to 10 years rather than 2. But as a patient, I implore you to take 3 key actions to take better care of your own health tomorrow. 1, treat your care like a complex business problem. If you had a major strategic issue at work, you wouldn't rely on one meeting or one opinion. You'd gather data, you'd collect viewpoints, and you'd synthesize. Your health deserves that same rigor. 2, understand the incentives we talked about today. The next time you walk into a 15-minute appointment, know that it rewards volume and speed and treat that interaction differently. Leverage resources like technology and AI to better prepare you for those short visits and pull out insights that they don't create time for. And 3, when given the option, choose models that think longitudinally, not transactionally. Integrated primary care models, value-based care, while they aren't perfect, their incentives are closer to yours. Doctors are expert advisors, but you are the business owner. Everything looks fine. I understand that sentence differently now. It didn't mean that I was healthy. It meant that the system wasn't yet ready to act. When I was sent home without answers, I did something the system didn't create time for. I tracked patterns across months. I connected symptoms with specialists. I asked different questions. With the right information and time, I became fine. But I never did get that diagnosis. We need to understand the system that we operate in and navigate it strategically. Only then can we redesign it to give us the care we need when we need it. That's the shift from crisis to care. Thank you.